let's look into the clinical anatomy of parotid gland. It includes parotid abscess, Frey Syndrome, mixed parotid tumor, and parotid calculi. The first condition is parotid abscess. This, as you can see in this picture, this is how it looks, and this is caused because of the infection. Suppose if there is infection in the mouth that enters through the opening of the parotid duct, as you can see in this picture. From this, the infection enters the parotid gland and lead to pus collection later and leads further into parotid abscess. So this is the first condition. The next condition is parotid tumor. Tumor can be, as we know, as we are read in general anatomy, it can be malignant or benign. So benign tumor, its characteristic is what? It will be a painless tumor. It will be slow in growth, and what we have to remember is it does not involve the facial nerve. So that is benign. Malignant is, it will have a rapid growth and it will be hard with the involvement of the facial nerve and enlargement of the cervical lymph nodes. So this is a malignant characteristic. Next condition is parotid calculi. The parotid calculi can be in the salivary gland itself, or it can be in the parotid duct, where the parotid duct is called as Stensen's duct, right? So there are chances of this condition also. Next is Frey Syndrome. Frey Syndrome, first suppose the parotid gland is being removed because of parotid abscess, tumor, or any condition. That time what happens is, normally the parotid gland is being supplied by the auriculotemporal nerve. These are the parasympathetic fibers. When these stimulates the parotid gland, there will be saliva secretion. Now, as I told already that the parotid gland has been removed. So when the parotid gland is removed, these auriculotemporal nerve, which is already present, these starts regenerating, and instead of connecting to the parotid gland, now it's not present, right? So it supplies the fibers to the sweat gland which is present, and these sweat gland get stimulated, and whenever the person eats, right, so the saliva stimulation will be there, right? So instead of that, there will be sweat gland stimulation, and it will lead to sweat secretion whenever the person eats. So as I had put it here, the sweat glands get stimulated and it will produce redness, sweating in the areas of the skin supplied by the nerve, and this is called as Frey Syndrome, and that is why it is also called as auriculotemporal nerve syndrome.